During today's Doctor's In, we wanted to take a look at abdominal aortic aneurysms. It's the ballooning of the abdominal aorta that can lead to a rupture. Older men who smoke and suffer hypertension are more at risk. Dr. Craig Silverman joins us live to discuss. Dr. Silverman, it's so good to see you. Is this something that you're seeing in your practice?
We see this very frequently. Yes.
And so what is it typically? Am I going to feel something in my heart, or is it something that I need to go and get diagnosed by you?
Well, that's the problem, is that most of the time people don't feel them until or unless they rupture. And when they rupture, it's catastrophic. It's a problem. The problem is as you get dilated, as the aorta dilates, and remember the aorta is the tube that carries the blood from your heart to the rest of the body. It's the largest artery in your body. So that when it gets bigger, and sometimes it does, and it's like a balloon, the stress gets too high and the walls rupture. Generally, sometimes if it gets big enough, you can feel a pulsatile feeling in your abdomen, but most of the time you don't feel much of anything. Sometimes you can also feel some pain in your back, but that's not very common.
And so we mentioned at the beginning of this that it's older men who smoke. Is it also for former smokers as well?
Correct. We're starting to diagnose this and starting to test on any man over age 65 who's smoked in their life. Now, I do sort of limit it sometimes where people say I've only smoked in high school or I had a very limited time. But if you smoke for 10 or 20 years at some point in your life, it's time to get tested.
Okay, and so treatment, once you realize what's going on, what are the treatments? Is it mostly medication? And when is surgery required?
Well, generally, surgery is not indicated unless the vessel gets big enough, and the size of the vessel, and it depends a little bit about the rapidity of how big it gets big. That is, if it goes from a small size to a big size in about 6 months or a year, it's time to operate. But if it does that over time, you can sometimes wait for it. Generally, around 5 centimeters, which is about 2.5 inches wide, is about when we think about operating. And when we operate now, it's generally not open operation. It's generally done endovascularly. That is, by a large stent. A stent gets placed inside your aorta, inside your abdominal aorta, and basically the blood flows through there rather than the regular vessel.
And really quickly, what are some preventative measures we can take?
Well, stop smoking, watch your blood pressure, exercise, watch your cholesterol management as well. Also understand your risk factors. Talk to your doctor about this. If you have a history in your family of abdominal aortic aneurysms or other types of aneurysms, if you have other types of aneurysms in your body, those kind of things, those put you at increased risk. So know what your risk factors are, talk to your physician, and get screened.
Dr. Silverman, as always, we appreciate your time. Thank you for waking up bright and early with us. Yes, absolutely. If you have a question for the good doctor, send us a text at 361-855-6397.